Well, it's another great day for Queensland. Really good news for Queensland. Another day of no new cases of COVID-19, meaning our total number remains 1,150. We have 25 that are active, and in the last testing period, we did 5,751 new tests. It's now 8 days since we consider we had someone infectious in our community. Obviously, we would hope to continue to see no new cases or only new cases in quarantine up to that 14-day period, at which time we can consider lifting restrictions. Of course, Queensland continues to sit in stark contrast with other parts of the world. You will have heard the tragic news overnight that the second wave in Europe has now surpassed the first and is yet to peak. 943,000 people have died due to this virus as the world inches closer to that million death mark. Again, in Victoria, while they continue to get their cases under control, which we very, very much welcome and continue to assist them, they again saw more deaths in one 24-hour period than we have had from this disease in Queensland all year. I'm really pleased to report that after a lot of work from our Chief Health Officer, as well as detailed conversations between the Premier and the Chief Minister of the Australian Capital Territory and between our government and the Canberra Airport, we are announcing today that we will lift border restrictions on the ACT from 1 a.m. next Friday. That means that people from the ACT will again be able to visit Queensland. We've been saying for some time now that for Queenslanders, Queensland is good to go. Well, now for Canberrans, Queensland is good to come. And so now is the time we would urge them to start thinking about coming up to Queensland for a holiday. This is timed to coincide with the school holidays in the ACT. It's a great chance for people to come and visit friends and relatives or go to the reef, go to Cairns, go to one of our wonderful tourism hotspots. This is great news for the ACT and, of course, is recognition of the fact that they have been some time now without any active cases. We're also confirming today that sewage testing in the Hervey Bay region has identified very low levels of viral fragments in the wastewater there. The hospital and health service there will be taking necessary steps to ensure that there isn't any unidentified community transmission there. It's a bit like the Early Beach situation we outlined to you not long ago. There's no reason at all to panic. We're just letting people know that we have those results and that there may be some activity from the public health unit there.
So very good news, no new cases. So we remain at 54 cases related to that cluster, that Melbourne-Logan cluster, the Brisbane Youth Detention Centre cluster, Arthur Gorrie and the Corrective Services Academy and the Ipswich Hospital. So we've not had any case out in the community infectious in the last 8 days, which is really good, and we just wait to see what happens over the coming days. It's a little bit too early to totally relax, so it's really important, more important than ever, that if you have any symptoms, to come forward and to get tested and to isolate yourself till you get that result. This is important across the whole state. As you've just heard from the Deputy Premier, we are testing sewage across the state now, and we are picking up virus every so often. We're not sure at this point in time what that really means, but we're taking, of course, a very cautious approach to that, and wherever we're finding virus, we're asking people to come out and get tested so that we make sure we don't have community transmission in that community. We know you can shed virus for a long, long time, but we don't want to ignore the fact that perhaps, maybe, that virus is there in the sewage due to a recent infection. So that's why we're doing this, just to be very careful. But it's really important that across the state that people continue to come forward to get tested. So I always say, if we can find the first case in a cluster, we can clamp down on it very, very quickly and not end up in a large outbreak. No, at this stage it's still 28 days. That of course is the safest, because then if you do miss one transmission cycle, you then will be more likely to pick it up the next. So it's just being really careful. You might remember we had that gap between our initial cluster from those 3 young women who went to Melbourne, and then opened up and we got a second cluster, and now it's pretty certain they're related. So it's just all about the risk of having a cluster that you don't pick up. I'm convinced that that's been sorted because of the work that's been done between Queensland and the ACT. So anyone who goes from New South Wales to Canberra will need to wait for 14 days before they can come to Queensland.
So you mean they'll have to quarantine in Canberra for 14 days before they can come here?
Well, not quarantine, because Canberra doesn't have that in place, but they will have to stay in the ACT for 14 days. So people can come to Queensland today as long as they have not been in a declared hotspot in the previous 14 days. So people can come from the ACT as long as they haven't been in a declared hotspot, which is currently New South Wales and Victoria, in the previous 14 days. No, loss of voice is not a symptom of coronavirus, and every single day that we meet at AHPPC, we discuss whether symptoms should be added to the list. So most recently we added diarrhoea, vomiting and nausea to that list. We've also recently added a runny nose. But no, loss of voice is not a symptom, no. No. No, but she was ultra cautious, and that is what I ask of every Queenslander. She was ultra cautious, and although there was no need for her to do it, she went and got herself tested.
So Queenslanders lose their voice, they don't need to go and get tested?
No, but I would encourage them to, as the Premier did. That if you've got a symptom, it's a good idea to go and get tested. Rather than think through, is it COVID, isn't it COVID, just get yourself tested. What we don't need, though, is perfectly well people to get tested. We still are testing a lot of perfectly well people because they're unsure, and that's fine, and we do that, but there is no need for it. It is really important that people who have symptoms get themselves tested.